record. Okay, good morning again. Thank you guys all so very much for jumping on to our July Optimized chats. It's so good to see people in one fashion or another right now, and we recognize just how hard it can be to network with everything going on. So hopefully this can be beneficial even if you just meet one person on here. So what I would suggest is if everybody in the chat that is on could put your information in, put your name, your phone number, what company you're with. It's just another way that we can connect. So please put that in the group chat so we have all of that information. And this is being recorded. It'll be shared online and on our website as well. So, so thank you again for coming on. And this week we are hosting Erica. She is a therapist with Buckeye Home Health. We utilize their services at Optimized and think that they're great, and we love that they have a holistic kind of view on how they care for patients. And we certainly try to be holistic as well. So I'm going to let her dive more into that. But just a couple new things or some points that I want to talk about with Optimized. So we are starting to have a chiropractor. He was on our Optimized chats last month. But our chiropractor is going to be starting August 1st, and he will be coming in to serve our residents at a really amazing price. And he's going to be coming in weekly to serve them. And it's just going to be great. You know, the whole thing would be to help prevent falls and just help their overall well-being and kind of a holistic aspect that we're bringing in. And then we did start outdoor visits. That was back in June when the governor allowed that. So we are doing outdoor visits still. So if anybody is asking, we do the outdoor visits, and we have a Sign Up Genius that our families can utilize to request the time that they want to visit with their loved one. We do also have a couple open rooms right now. One open room being a suite, and these suites can accommodate either 2 separate people at a little bit lower cost or a couple. And the great part, of course, about our model of care is that a couple will never have to get separated because their needs change. So they can stay in that room together, and we can adapt for their needs and bring in the services that they both would need. We did have our ribbon cutting earlier in the month, or was it the end of June? I don't know. But we had our ribbon cutting and for a third building. So we're so excited about that. It's really going great. Sprinkler system is going in now, and yeah, it's moving right along. So stay tuned on that building opening. We also are hiring for PRN caregivers, and we're doing open interviews every Tuesday. So if you know somebody looking, please send them our way with an open interview, or of course we can schedule a time. And those open interviews will all be outside as well. And then lastly, you know, we kind of holistic as well. We really believe in mental health and making sure our residents are cared for mentally as well as physically. So we did hire an additional activity person. So we've been having for a little bit now 2 activity people working with our residents, and they're working together. And the biggest thing is just to keep them engaged, keep them engaged, keep them engaged. And, you know, even if it's doing one-on-one or group activities, they've been really doing a fantastic job at getting to know our residents really well and spending time with them. So that's kind of all the little points I wanted to make about Optimized right now and things going on. And thank you all again so much for jumping on here. I see everybody is putting their information over there. Hopefully you can all see that. And I will file that too, and I can even email it out if ever, you know, if that would be helpful as well. So without further ado, I've heard myself talk long enough. I will introduce Erica. Again, she's a therapist with Buckeye Home Health, and she's just going to discuss benefits of skilled care and also just how they're a little bit different, how they're working with us, but you know, just how it's funded and all of that as well. So take it away, Miss Erica.
Good morning, everyone. As Lindsay kindly introduced me, I am a therapist with Buckeye Home Health Care. I have been a clinician for over 11 years. I focus on the geriatric population. It is a passion of mine. And I just wanted to share with you today some of the benefits that Buckeye Home Health Care has been bringing to the community and to some of our partners. Our key goal is to focus on, patient care. Everything is centered on patient care. It is more of a holistic approach. We work, not only physically, but emotionally and, with the mind. So we treat it all when we're working with individuals. So we like to keep those in mind. So we do offer our skilled services, and those are covered through their insurance. There's no out-of-pocket cost or copay. On the rare occasion that there might be a copay or out-of-pocket cost, we have our billing department make you guys aware ahead of time, and a lot of times we pick up that cost because obviously, sometimes we'll get insurances and, we'll see a case and, they might say, well, we're going to only pay for this much, and we'll cover that, So we offer a medical social worker. They can come out. They're really good with helping with counseling. We've had quite a few instances right now with the COVID. We've had a lot of our clients, suicide is a big thing, talking about that. So we've had to utilize our social workers more for that, to come out with the counseling. And then we do have psych nurses as well. And those are utilized, to work with the patients if there's, a change of behavior, if there's a psychiatric diagnosis, that sort of thing. So we do have those to implement as far as our mental health. Going along with mental health as well, we also have our speech therapy. So when I first started working with speech therapy, oftentimes I'd say, oh, you just talk with people. But since, working with them, I have, appreciated their passion working with patients as far as dementia. Now, whether or not that's early stage or late stage dementia, maybe it's a traumatic brain injury, but they deal with all aspects of the brain. They're really good at working with the families as well to how to communicate with your loved ones. And also how the staff at the facilities can work to better accomplish, dailies of activity. Sometimes I know I've had a patient in the past, giving them a shower was horrible. We couldn't give this individual a shower, and working with speech, we were able to implement different techniques to get them to shower. So they're really good at coming up with different strategies in that. And then swallowing, they work on swallowing, of course. And then they can work on, we had one individual, he had a brain injury, and speech was working with him to get back to work. He was a lawyer, so we were working, those type of things. So it's all aspects of that. My passion is physical therapy, so I can speak more on that. But so as far as physical therapy goes, we want to try to address issues ahead of time. If we can, if we notice you're starting to see an individual kind of backslide, we want to try to get involved and prevent, those hospitalizations by working on strengthening endurance, patient-centered goals. Those are our focus, and goals that are realistic for the individuals. So just to get them back to, a better quality of life. And then we have our occupational therapies, which, are going to focus more on, your bathing, your dressing. Maybe an individual wants to be able to go and garden out in the garden, or maybe want to prepare a meal, that sort of thing. We work with those. So that's, and then we do have our home health aides, which can come out during skilled services. And if there's a need to help with like showers and stuff, especially if we're working with an individual for occupational therapy and the goal might be they shower independently, that aide is trained with the occupational therapist to, help that individual be more successful when it does come time for discharge. So another thing I wanted to kind of bring up is we do have an easy transition program. And what that is we identify individuals out in the community that, you know, we're noticing, maybe they're more aware, families aware that there might be a need for them to be no longer at their home environment. So what we have done is, you know, we get our social worker out there, we work with a placement for these individuals. And by working with you guys at Optimize, we can, you know, come up with the best community, you know, for these individuals. That transition is a little bit easier than, you know, we can come in the facility and work with those individuals. It's a familiar face. We'll introduce the family and the client to your staff. You know, we work with all kinds of things to, excuse me, to get them more comfortable with the facility. Let's see. Do you guys have any questions or anything for me?
Hi, Erica. For questions supposed to be typed, sorry. Or can I just talk?
You can just talk. Go ahead, Linda.
Okay. You know, there are several of us on here from various hospice organizations. So I was wondering, how often do you refer back and forth with hospice?
So obviously, if there is the need, and we do this all the time, we work and partner with different hospice agencies. You know, we'll sit down with the families, and, you know, if that is an end of stage life, you know, we are referring back and forth. We want to do what's best for that individual, for the patient. So, you know, oftentimes, you know, unfortunately, you know, end stage dementia, we do, you know, hospice does have to be referred in, and it's better to manage that individual.
Erica, this is Mark Keeley from Senior Care Authority. You mentioned the Easy Transition Program. I know that you've been in, your company's in several communities that we have visited. Are you also doing home health? And then is that where you're seeing these people and then making recommendations for a living environment?
Yeah, so, you know, we want to keep them at home as much as we can, but we also can identify when it's no longer safe or they don't have the amount of help that they can at those, at their home environment. And so, you know, bringing in the social worker to help the family and that individual make those decisions, definitely. It's a little bit easier. We can identify, you know, let's have you look at these different communities. We think this might be, you know, a good fit. Try this out. You know, a lot of times we have individuals, they like the really big communities. And then we have those that like the smaller communities. So we definitely try to, we like to give the options. So we definitely are out there, you know, letting them know the different options that they have. And it's a good opportunity to also, for the families to find out, like, the financial aspect, you know, what is the cost going to be, so they have those options. Does that kind of answer your question? Okay. One thing I did want to mention as well, if I might be able to, so when we're partnering with these communities, we work and what we do is we try to figure out the best fit, the best programs, the best way that we can already help and support and strengthen the community, you know, with our partnerships. So, you know, whether that's helping with different support groups, you know, we've done Alzheimer's support groups, we've done monthly education pieces for the residents, families, or even the staff. So we want to treat everyone and work together for the greater good of the individuals at the community.
Okay, I have a question.
Yes.
I know you guys do pretty regular fall assessments.
Yes.
Whether they're one of your patients or not, you do that within communities. So
Yes.
Do you have any kind of statistics or any kind of numbers from kind of pre-COVID till after, because like you guys weren't allowed in so many buildings for a while, like how residents kind of fared without having therapy for a couple months?
So I don't have the exact numbers. I just know that it has declined. So with that, the different testing we do is we put it in a system that we've created, and what it does is it looks at the individuals. So let's say we've got an 83-year-old female. We have her run through a series of different tests. We compare her scores to what is average for, what is considered average, what is considered below or above average. And so what we do is we keep track of those usually quarterly, so we can catch if somebody's declining. It's really helped us, and when we do those, we don't necessarily have to pick somebody up for our services, but we can say, hey, we noticed you're a little below average here. Keep an eye on that, or here's some things you might be able to do in order to improve that. So, and that's open to everyone. Because like I said, we want to make sure that everybody is successful and staying as active and motivated.
So Erica, will you do that, that quarterly screen? Will you do that in the buildings that you're contracted with? And is that on everyone with their 90-day assessment?
So what that is, it's just open to kind of anybody. And so anybody has the right to, participate. We have individuals that don't. And we do it as often as, the facility, the residents there, they feel the need. Quarterly would, probably be, most beneficial, we've found. But what we do with that type of testing is we can modify that to individuals based on their level of function. So we might have individuals who are in a wheelchair and they're like, well, I can't do this testing. Well, we can modify those and still get different scores to see those. Does that kind of answer?
Well, personally, I think both for the community and for Buckeye Home Health, I think it's a great marketing tool to be able to say to the family, this community has therapists that are regularly checking your loved ones, screening them for falls, because we're into preventative medicine rather than crisis intervention. Right. So I think that's a great marketing tool for whatever community you're in.
Yes, thank you.
Yes, thank you, Erica. And I would just like to add how important both skilled services like a Buckeye and hospice is to a place like ours, because we're non-skilled. And so even though we have nurses on board, we got to be able to bring those services into residents. So having a company and having our nurse practitioners being able to refer to a company like Buckeye and having those nursing services and the therapy and everything else, I mean, that's completely essential to us providing the ultimate care for our residents, as well as hospice. I think I mentioned that, but hospice as well, it's huge. Shauna, I know you're on here. Would you like to add anything else to that and to the skilled services and how that's important to a place like ours, like a residential care home?
Well, I would just like to say that it is, can you hear me? Yeah, okay. I would just like to say that it is beneficial to be able to reach out and have those home health agencies like Buckeye just come right on in when we need them. It's good that we have nurses here with our clinical eye, but when we can call that third party provider and they come in and assist us, it's really helpful.
Great. Are there any other questions for Erica regarding skilled home care services? No? No. All right. Awesome. Well, thank you all so very much. Like I said, we want to be able to keep this short, get a little bit of information. When I listen to podcasts or anything, it's all about those nuggets, right? Even if you can listen for 5 or 10 minutes and you just get one little nugget of information or get to meet at a networking event. So hopefully you guys got a little nugget today. And And again, I will send out everybody's contact information that was on here. And hopefully you all can join us next month for Optimized Chats. We will be hosting Eric Christensen with, he helps with Medicare. He helps provide all these benefits to anybody over the age of 65. So that'll be really informative. And yeah, so thank you all so very much. You all have a blessed and happy Wednesday, and we will see you all soon.
All right.
Thank you,
Thank
Lindsay.
you.
Good seeing you.
Thank
Thanks,
you.
everybody.
Thank you.
Lindsay, do you have a particular Wednesday?
Bye-bye.
Third Wednesday of every month.
Third Wednesday, great. We'll get it on the calendar.
Okay, great.
Thank you. Thanks, Erica.
Thank you.
Hi, everybody.